Welcome, everybody. I'm Jessica Davis, Marketing and Communications Manager for Fear Free. Thank you for joining us for New Ways to Do Old Things in General and Emergency Practice with Dr. Jonathan Bloom, sponsored by Elanco. Dr. Bloom is a private practice owner and medical director of one of Canada's first 24-hour veterinary hospitals. He's also an active member on the Fear Free Advisory Board and is a leader in progressive veterinary healthcare and appears in veterinary journals worldwide and is a sought-after speaker for veterinary conferences across North America. We're very excited to have him speak with us today. So Dr. Bloom, take it away.
Well, thanks, Jessica, and welcome everybody. Thanks for taking the time out of your day to spend the time with me, and hopefully together we can enrich your practice. You know, I've been hearing a lot lately about, I get the philosophy of Fear Free, I understand what it's all about, I understand the theory, I get the basics, I just want to know how can I get this job done? And what better way is there to kick off a new year than talking about new ways to do old things? I'm going to spend a little bit of time in this webinar, take a brief moment just talking about the philosophy, and I won't dwell on that because, again, I know what you're saying, I get the philosophy, but I just want to make sure we're all on the same page, and so we'll spend a little bit of time just talking about the philosophy briefly, and then we're going to talk about some building blocks. Some of them will be new to you, and some of them will be very familiar to you, and then we're going to get to the crux of this thing, the jewels or the golden nuggets. And I know that everyone wants to skip right to the end and get to those jewels or those golden nuggets, those key take-home points, but I don't want you to discredit or downplay or minimize those building blocks. And here's why they're so important. I want you to think about, going to a movie theater to see some new comedy, the blockbuster comedy that's just coming out. And you want to get to those gut-busting jokes, those one-liners that just leave you doubled over on the floor in laughter. You want to take those gut-busting jokes home and you want to share them with your friends and the people at work. And those are the jewels that I'm talking about. But I also need you to think about the simple things, the basic things through that movie. Like, what if the seat was really hard and uncomfortable that you were sitting in, or the theater was cold, or the people beside you wouldn't stop talking? How would that affect your movie experience? All of a sudden, it puts you in a bad mood, and all of a sudden, those your favorite comedian or that movie that had such great potential just isn't so good anymore because the whole experience was ruined. And so I want you to take a look at this from a pet owner's perspective and a pet's perspective, and don't just look for those golden nuggets, those take-home messages, those jewels. Look at the entire experience because they will build on each other. And so we'll spend just a little bit of time also talking about some of the basics, and then we'll go into the bigger stuff after that. Okay, so just so everyone knows, I'm sitting here in my home, and my PowerPoint presentation that you're all watching is being operated out of Denver, Colorado. So you're going to hear me asking Jessica just to advance the slides for me, but we're going to get through this and we're going to have some fun, and hopefully we can get you going back into practice tomorrow or on Monday and approaching your pet health care to what you were doing before. Okay, Jess, let's go to the next slide. So I want to look at the impact of fear, anxiety, and stress. I want to look at that from 4 different perspectives. There's a physiologic perspective I want to touch on briefly, a statistical perspective that I want to touch on briefly, a neuroanatomical perspective, and then clinical signs and practice. And I want you to imagine yourself in that exam room. I want to imagine yourself going into your hospital or veterinary practice and make this real. Don't think about it as just Bloom talking. Put yourself in that position going into practice. How will you approach your client differently tomorrow? Okay, next slide, please. From a physiologic perspective, go ahead, Jess. From a physiologic perspective, I just want to touch on a few of the changes that happen from fear, anxiety, and stress. And a very simple study done by Jessica Quimby at Colorado State University several years ago She just looked at 30 cats. She had them in their home environment. She monitored their or checked and recorded their vital signs, temperature, pulse, respiratory rate, blood pressure. And then she had the owners drive them to the veterinary hospital and repeated those same measurements after those pets arrived and waited for about 15, 20 minutes. She repeated those measurements just to see what would change. She did the same thing, by the way, for dogs in the separate study and got similar results, but we'll just talk about the cat study here for simplicity. Just by driving and arriving at the veterinary hospital, the cat's blood pressure went up as much as 31 millimeters of mercury, 31 ticks. That's real, and that's important. You know, if that cat was a normal, healthy cat and had high blood pressure, you would say, well, it's probably just stress, and you probably wouldn't medicate them. But if it was the same cat who happened to just by chance have renal failure, then you'd get those same blood pressure measurements and you'd say, yeah, he's maybe stressed, but I'll put him on medication. And so that drive to the veterinary hospital really does influence blood pressure and will influence your treatment decisions. So really important that we look at the totality of all of this and see what we can do to keep that blood pressure to the most realistic or reflective of the pet's normal health at home. Heart rate went up as much as 76 beats per minute. You know, when I go to veterinary hospitals and I look through their EMR, their electronic medical records, or I look through their files and I see what the average heart rate of a cat is, it's usually around 160 to 180. The average heart rate of a cat in my practice is about 120 to 130. And I think when you speak with people who are practicing fear-free, doing a lot of the things that we're going to be talking about today, I think you'll find the same. Check the heart rate of your cat resting at home on the couch. It is not anywhere close to 160 to 180. At rest in a normal environment, their heart rates are closer to 120, 130. And the respiratory rates went up as much as 108 breaths per minute. So again, higher respiratory rates. These are all changes just that occurred from bringing the pet from home to the veterinary hospital. Next slide, please, Jess. So we'll look at this now from a statistical perspective. This is a study done from Italy, but there's no reason to believe that it would be any different in North America, the guardianship perspective of dog welfare. So what this is they looked at almost 1,000 dog owners and just over 1,000 cat owners, and they asked those owners their perception of how their pet was feeling when visiting the veterinary hospital. And you want to write these numbers down or take a screenshot if you want, because we're going to refer back to this throughout the presentation. So 77% of dog owners said that their pet showed signs of stress before entering the veterinary clinic. And 63% of dog owners reported that their pet had a dislike for being in the lobby or the waiting area. 46% had a reluctance to enter the exam room. And 73% didn't want to be up on the exam room table. And if you look at the cat side, not so different. Again, 77% of cat owners said that their pet had signs of stress before entering the clinic. 73% had the dislike for the waiting room, and 79% had a reluctance to enter the exam room, and 85% didn't want to be on the exam room table. And these are real numbers. And if there's one thing that owners know way better than veterinarians about their pet's health, it is when is their pet stressed. And veterinarians sometimes, and veterinary healthcare providers, sometimes fail to recognize it because we're just so darn used to it. We see pets all the time showing signs of stress that we just consider it the new norm. And we almost become numb or immune to it, that we don't even recognize it anymore as a problem. But pet owners do, and that's the reality check for us all. So that's what fear and anxiety looks like from a statistical perspective. Next slide, Jess. From a neuroanatomical perspective, and I like to talk about this because some people want they want the data, they want the scientific proof. And so next slide, Jess. So there's a little part in your brain called the amygdala. It's like the size of a pea or the size of a walnut. And that part of your brain stores all memories of fear. And once it's in there, it never comes out. So I always say we're scarring these amygdalas. And you've all had those experiences. Yep, people have those amygdalas too. So just think about for a moment a time in your childhood or maybe 20 years ago where something really traumatic or something really frightening happened to you. It is in the amygdala and you will never forget it. And I want to share with you an experience that I've had, and I've shared this story before. I remember in the early 90s, I was driving through an intersection. I stopped at the stop sign and then I saw another car coming from my right and I thought she was slowing down to stop at her stop sign. It was a four-way intersection. I proceeded through the intersection and turns out she wasn't stopping. And she hit me from the side, from the right side. And I remember that moment of impact. I remember hearing the screech of her tires. I remember looking over my right shoulder. I remember watching her grab the steering wheel with both hands. Her eyes popped open. She had big blonde puffy hair. It was the early 90s. Her mouth popped open. I remember watching her clench that steering wheel. I remember the moment of impact. I remember moving sideways. I remember the glass shattering beside my head. I can even remember what I was listening to on the radio at the time of impact. I know what song it was. That's a story that I can recount for you in vivid detail from 20 years ago. And I can't tell you where I was last week or what I did 2 days ago, but I remember that accident like it was yesterday, and I remember it because it was in my amygdala. So think about that in your own experiences. We all have them. Then I want you to think about that scarring the amygdala next time you go to work and you trim a cat's nails. You've got one person sitting on the front, one person on the back, and somebody else is trimming their nails. And that cat is hissing and spitting and maybe hollering and trying to get away. And the only reason why it's still on its side on the table is because they have 300 pounds of people holding down that 10-pound cat. And that's the only reason why you're getting that nail trim done. They're maybe trying to urinate or defecate, and they are just panicked. And we have scarred their amygdala, and they're never going to forget your name, and they're never going to forget where they were. And the next time they come back to your practice, what are they going to remember? That frightful event, just like Bloom remembered his car accident. So think of that through the nail trims, the ear cleans, when we look after the hot spots, when they recover from their neuters and their spays, when we attend to wounds, when we're taking fine needle aspirates, doing cystocentesis, collecting blood samples. If that pet is stressed, you are scarring that amygdala and it's too late. It's already locked in there. And then we got to try to figure out strategies to work around it, which we're going to do through the rest of the webinar today. Okay, next slide, please, Jess. I want to look at it finally from a clinical sign, just to remind everybody what this looks like in general practice, because as I was saying, a lot of us are numb or immune to seeing this. We just get so used to it that we don't even recognize it anymore. Go ahead, Jess. Next slide, please. Good. So when I walk into an exam room and I see a cat there hiding behind, whoops, there's my, okay, we'll leave it right there. When I walk into an exam room and I see a pet hiding behind a computer, there's a cat back there, that's fear. Next slide. When I walk into the room and they're hiding underneath the table and all you see is their nose, or hiding under the bench, hiding behind the owners, and all you see is their nose sticking out, that's fear. When I walk into a room and I see a dog clinging to the owner, trembling, maybe dropping hair, that's fear. And if you look at that dog's mouth, you might also notice that it's open. And I don't know what he's doing there. He could be yawning, which is a sign of fear or stress. You watch pets in the exam room and you see them yawn, they're not bored. They're fearful or stressed. He might be panting, and if the tongue is hanging out and loose and floppy, maybe he's just trying to cool off. But if that tongue is retracted back in the mouth, or maybe it's sort of rigid and curled up a little bit, showing the muscular aspect of that tongue, then that's likely fear. Or maybe he's whining, again, fear, anxiety, and stress. Next slide, Jess. We can also look not just where they are in the room, but we can look at their body posture. And when you look at cats and you see the ears back or to the side, um, that's a sign of fear, anxiety, and stress. Their tail, we see this all the time. Their tail is sort of tight to their body, so they're sitting down and their tail is sort of wrapped right around their thigh and down under their groin area. You think, where else could they put their tail? But they don't have to hold it so tight to their body. That's a subtle sign of fear, anxiety, or stress in cats. They're hissing and spitting, that's obvious. And those big pupils, again, signs of FAS, or fear, anxiety, and stress. How about those dogs? Ears are forward or to the side. You got to look for these. Now, everything's in context, right? So if it's a dog who's had its ears cropped and pinned, or if it's a husky whose ears are always up, that doesn't mean that he's necessarily fearful. It just, that's the way his ears point. If their tail is tucked, we all know that's a sign of fear. Or if it's above top line. So if you draw a horizontal line from their shoulders to the rear end, so along their spine, and keep that imaginary line going, if their tail is up and above that, they might be fearful and stressed. Their tail might be wagging, which could mean they're happy, but it could also mean that they're willing to bite or getting ready to bite. All the tail above top line and wagging means is that they're stimulated or aroused. And just because they're wagging their tail does not mean that you've got a green light to go ahead. You have to look at everything in context. Obviously, growling and whining and barking are signs. They don't do that at home when they're sitting on the couch, right? So something's changed. And if you look at their eyes, again, big pupils, just like the cats, and this thing called whale eye. So that's when you see their whites of their eyes. Now, again, everything in context, right? If it's a pug, you always see the whites of their eyes. Even when they're asleep half the time, you can see the whites of their eyes. I might embellish a little bit. You know what I mean. When their eyeballs are popping out because they're fearful, just like that lady's eyes were popping out before she hit me on impact, as were probably mine. That's what we're talking. So watch for those more subtle signs, because we'll see them every day. Next slide. And so when I lecture at conferences and I ask people, when's the last time you saw some of these things? I usually get through just one or two slides and they've all put up their hands by then, if they've seen that in the last day of work. And the truth is, you probably see these signs if you look for them, if you recognize them and identify them. You'll see them in about 50% of the patients who come through your door. 50%. And so half the pets we see are exhibiting signs of FAS, or fear, anxiety, and stress, when they come through our practice. Even for routine things like, having their annual or biannual, every 6-month health exams and getting vaccines. We see it every day, all day long. And so this dog here, hiding in the corner, his mouth is open, his tongue is back, and I bet you if we could get a close-up, which I don't have for you, you'd see his pupils dilated, his eyes are big, his tail is tucked. He's got all the signs of fear and of not wanting to be there. So let's move on now and talk about then why you're here. How can we make this the best experience imaginable for pets? And so it's going to start right here with smart scheduling. And these are some of the basics that I want to go through. Smart scheduling allows a steady flow of traffic through your hospital. It avoids stressful interactions in the waiting room, and I think that is absolutely key, that we should never take for granted. And it avoids stress amongst the pets, the staff, and clients. Trust me, your staff do not like when they have 6 blood draws to do in the next 10 minutes. So if we could spread those out and be a little bit smarter about how we schedule, we can be a lot better off. Okay, next slide. When I look at a lobby that looks something like this, I see a gentleman purchasing food at the very front, and then there's a dog who's staring down a lady and her cat that's in the carrier. I think this just does not look like a good idea to me. This is not what we should be having in our lobby. Imagine being an indoor-only cat, and all you know is the top of the couch and the owner's walking back and forth. You never go outside, and all of a sudden, you've got this dog staring you down, you've probably been in the carrier on the car ride in and it's cold outside or cold in the car or very hot, and you're just not used to all the stimulus. And so they've walked in the hospital and they're already stressed. And we're looking at things before from a statistical perspective, and I asked you to take a screenshot or just jot down some of those numbers. Remember that 63% of dogs and 73% of cats don't like being in the lobby. They show signs of stress being in the waiting room. And so here we've got a dog and a cat, both who are going to be waiting in line exactly in the very spot that they don't want to be. And we haven't even walked into the room and started the exam yet, and we're already elevating their blood pressure and their heart rate and their respiratory rate, and a whole bunch of other changes that happen from fear and anxiety and stress. So we have to be a smart scheduler. Let's take a look at what that looks like. So here I've got seven pets on the left side, common scheduling: Charlie, Ripley, Bentley, Tucker, who's a cat, Stanley, who's a cat, Alvin, and Wiley, and they're all being seen from 9 o'clock in the morning to 1 o'clock in the evening. So we've got 7 pets over 4 hours. Well, you know that when Charlie shows up at 9 o'clock and is getting ready to leave at 9:20, just as Ripley's coming into the building, they're going to be meeting at that front lobby area, and all of a sudden, just after our first appointment, the bottleneck at the lobby in the waiting area is already starting to develop. And so think about Tucker at 10 o'clock, who's an indoor-only cat or who doesn't like dogs, and Tucker's coming in just as Bentley's coming out. And who else knows what's going on in the hospital at that time too? People buying food, picking up prescriptions, paying their bill. There's a lot of commotion. There's a lot going on there. And the part that we can control is when we schedule people to come in. If we were to take those same 7 appointments and just give some thought and schedule smartly, we'd be in a lot better shape. And so we've done that on the right side there, the fear-free scheduling, where we have Charlie coming in at 9. Charlie will be long gone before Ripley shows up. We can look after Ripley without hearing Charlie barking in the room next door. When Ripley leaves, Ripley will be long gone before Bentley shows up. And the nice thing is that Tucker, who comes in next, won't ever see the dog and won't ever see the other cat. And so we've just spread them out. And I think we really have to get away from this notion of we'll just put appointments wherever we have an opening and try and cram them all in. Clients will come and see you because they respect you and they love you and they want your attention, and they will come see you when you have room for them. We're used to this in every other aspect of our life. Why do we have to rack and stack them all between 9 and 11 o'clock and then have this big gap, in the in the late morning? Why can't we just spread them out and take back control of our schedules to create these better experiences? It's not just the pets who get stressed. The pet owners get stressed. They don't like waiting in the waiting room and being behind a lineup of other pets, some of whom are very sick, some of who are barking, and knowing that their cat doesn't like being around, or their dog doesn't like being around other pets either. So they get stressed, and so do your staff, because you're calling on them incessantly, nonstop, and they just can't keep up. So the same 7 pets over the same 4 hours, and we just made it a lot less stressful for everybody. For busier practices, you can still start adding in those blanks. You can see more than 7 appointments in 4 hours, but after Charlie at 9:20, you might want to schedule a recheck, something that's maybe a little bit faster, maybe a fast procedure that will only take 10 minutes. And so we can be a little bit more smart about how we schedule. Okay, next slide, Jess. I want you to look at hiding the scale. When we look at this slide, can we run that video, Jessica? All right, I don't know if the video is running so well for you, but you can see that's a dog who just simply does not want to get on the scale, and we see that all the time in practice. And you know what's going to happen next. Reception's going to come out and start pushing the dog from behind. The owner's trying to pull it on from the front, and It's just a bad experience. And again, we're getting all stressed and we're just trying to weigh the dog. We haven't started the appointment yet, really. And what do other people at the bottleneck seeing because we didn't schedule smartly? They see a dog whining, barking, trying to get away, and that only heightens their level of fear, anxiety, and stress. And so we just have the perfect storm developing in our lobby before the appointment even starts. All you have to do is hide that scale. So take that scale, move it out 3 feet to the left. On the top left of your screen, you're going to see a hallway. I'll show you what we did to this dog. Jess, go ahead. So, whoops, that's the same video. Next slide. There we go. So we just moved the scale out 3 feet to the left, and we brought the dog down the hallway from the backside there and put our welcome mat over top of it. And so here comes the dog, and the scale is hidden, and the dog's still a little bit stressed. You can see he's panting, a little bit weary, but now we have a weight on him, and it was a whole lot easier to get him on the scale instead of pulling him and pushing him. And it's just a little point, but you can be creative and you can change the whole experience so that that dog is now perfectly weighed and can go into a room and not have to be stressed or weary of what's about to happen next. Next slide. If you want to get a little bit fancier, and you can hide those scales in the floor. This picture is compliments of Heather Lewis from Animal Arts. Hey, if you want to see a little stroke of brilliance, meet with Heather if she's at VMX or Western, or give her a call. She has done some incredible modeling, remodeling, and renovation and startup building clinics from scratch, and she is doing some crazy innovative, smart design for veterinary hospitals. And so she's figured out a way to take these scales and just put them flush with the floor, and pets walk on them and they don't even know that they're being weighed. So there you have two ways. If you're starting a new clinic, hide your scale in the floor. If you already have an existing clinic and you don't want to do a huge renovation or dig out your floor, just put a carpet on top of it. Okay, next slide. I want you to all take a look at and start playing music in your exam rooms. This is a powerful, simple thing, and I know a lot of you know about this, but I think a lot of you aren't yet doing it. Just without getting into too much detail, because I want to keep these simple things very brief before we get to the bigger things. Great little study published in JAVMA just a year and a half ago or so, and they looked at people who had visited the veterinary hospital with their pets for routine visits, pre-surgical exams and vaccines, routine things. And some of those pet owners and pets were exposed to classical music playing in the exam room, in the consult room, and some were not. And what they found, and that was by design, by the way, and what they found was that pet owners who were exposed to music during the course of their veterinary consultation associated that visit much more satisfactorily than pet owners who were not exposed to music during the course of the veterinary consultation. So music is very calming and perceived to be beneficial by pet owners. Now, pet owners, by the way, if the music is calming for the pet owners, then if they're not stressed, presumably their pets might be less stressed. Or said the other way, if the pet owner is stressed, quite likely the pet will get stressed as well and feed off of that. So that's the impact that it has on pet owners, but it also has an impact on pets. And so a study done, there are so many studies on music. I'll just tell you about one briefly. They looked at pets that were in kennels that were exposed, dogs, by the way, that were exposed to heavy metal music and classical music and no music at all. And what they found was that those pets, when observed, they had a video on them, and then they had somebody watch that video with the music off, so the observer, or the person trying to assess the dogs, didn't know what music those pets were exposed to. They were just judging their behavior and trying to determine if they felt that those dogs were stressed. It turns out that the dogs that were listening to the loud heavy metal music heavy metal music, those pets were shaking and had more awake hours. The dogs that were listening to classical music had more sleep and quiet hours. And how that compares to the control group that had nothing. So we now put classical music all of our in our dog wards and our cat wards, and all of our consult rooms have music playing. If nothing else, and I say if nothing else because I still think there's a lot of data and a lot of research that needs to be done in the area of acoustics and how it affects behavior in pets. But if nothing else, it tells owners, hey, look, I'm trying to do everything I possibly can to create a better experience for you and your pet. And owners really appreciate it. And I know for sure, 100%, that they're much more calmer themselves in the room, because half the time when I walk in the room, the owners say, Bloom, I was waiting for you. I was falling asleep listening to this music. And I'm thinking, yes, perfect. It's better than being angry and stressed. So um, this is iCalmDog. You can go to icalmdog.com and you can order these players. There are other players that you can get that you can play in your room. Just play some classical music. We just did a great renovation at one of my hospitals in Toronto, and we piped in music to every room and through the overhead speakers, and so music plays automatically and throughout the entire day. All right, next slide, Jess. Cozy non-slip exam tables. So we'll look at this next picture here. If you, this is the standard of care. This is what we're used to. We've been told forever how stainless steel is the best table ever, and they are good for many reasons. I mean, they're durable, they don't scratch, they really stand the test of time, and I think that's great. But what does it look like from a pet's perspective to have to go onto that table? It's slippery. It's the sunlight from outside reflects off of that, or the pot lights from above, the lighting on the ceiling blows down onto the reflective surface, and that light bounces back up into the pet's eyes, and so it can be blinding. Next time you walk into your room and you turn on the lights and you have a stainless steel table, just put your head, lean over that table and stare right down at it, as do a lot of our pets, and you'll see just how disturbing it is and how much it can bother your eyes. And a word of warning, if you have these tables near a window when it's hot outside and the sun's shining in, those tables heat up a lot. Look at it also from a pet owner's perspective. It is a cold looking, harsh table. Would you rather be examined on this table or on this table? Next slide, Jess. That's the exact same table. All we've done is we've taken a yoga mat and put it on top of the table so we have a little bit of cushion and a little bit of grip, and it's non-slip. And then we put a blue towel on top of that for easy cleaning. That is a much more comfortable experience and sets that pet up for a much better experience. And it's much more greatly appreciated by pet owners too. You won't have those dogs that are slipping on the table and the cat's trying to get away from you. Sometimes they'll just lie down on the table. It's by no chance, by the way, that that towel is blue. And again, speak to Heather Lewis at Animal Arts in Colorado. She's done some studies and looked at, sort of gathered some data on colors, and blue is a favored color of pets. They are not colorblind. They don't see just black and white. They can see color. They see blue. They might not see blue the way I see blue, and they might not see gray the way that I see gray, but they can certainly differentiate these colors from other colors. Little study done at UC Davis by Terry Wong. She just took a bunch of toys that were the same in every way, shape, and form, dog toys. So let's say they're Kong toys, for example. And they're the same size, the same shape, the same weight, the same texture. They were the same in every way except for color. And she just took, a blue and a red one and put them in the cage, and then watched to see what the dogs went to first and which ones they interacted with more often. And then she put a blue and a green one and a blue and a yellow one in. And then they got all that data, and what pets like the most are blue and red over green and yellow. And so what people have done then is they've taken that and they've looked at what people's perception are. What do people like to walk into? Because we want, a veterinary hospital that feels cozy and inviting for the people walking in as well. And we've come down to, these blues and the grays and the mauves and getting into the greens. These are the ideal colors. And so it's not by any surprise that when you walk into my hospital, we have either a blue or a gray towel on every table. Those are the ones we stay with, and we try to stay away from the whites because there's some belief that maybe the whites are a little bit more startling to pets than these colored ones. So in any event, non-slip, cozy, inviting tables. Hey, would you like me to take you out onto an ice rink and just leave you in the middle of that slippery ice and have you find your way back onto solid ground or onto the regular ground? You'd be slipping and sliding all over the place. And that's why when you go to hockey games and someone comes out to sing the national anthem, they roll out that red carpet so that they're not going to slip at center ice. And why would we think it any different for our pets? We should not make them slipping on these tables at center ice. See, I'm Canadian. I can bring hockey into any discussion. Okay, next slide. I want you to look at the exam locations. We need to vary where we examine these pets. Next slide. So we can examine them up on tables. Next slide, Gus. We can examine them on scales. I walked into the exam room and this pet was just sitting on the scale. Could have been anywhere in my room it chose to be. He chose to settle down on that scale, and so it's our habit to take those pets and just haul them off of the scales and put them on the table. Why not do the whole exam right there on the scale? Next slide. We are not going to get into today, but there's this whole body of knowledge about how to prepare pets for travel to the veterinary hospital, and that includes getting them reacquainted with their carriers and making their carriers a desirable place to be, rather than having them the owners bring out the carriers and then the cat scrams under the bed and get in the carrier. So there's this whole bunch of information about how to make those carriers really inviting and a great desirable place to be for cats. And then we get them into the consult room, and what do? We take them right out of their carriers. Why don't we leave them in their carriers? We've worked so hard to keep them there, to get them reacquainted and happy with their carriers. Why not just leave them in? And so this cat's there getting some food from the owner on the top left, and looks like we're taking a blood pressure on this cat. Okay, next slide. And this is an old arthritic dog. This dog was in the consult room, which is actually behind where I am there. And I noticed that he was having some problems standing. His legs were trembling a little bit. I think he had his nails out a little bit. And he just didn't seem comfortable for me. He's like that dog in the middle of that stainless steel table or in the center of the ice. He just was having problems. So I took him out into the hallway where we have a little bit more grip, and I had him stand there. And sure enough, just by moving out the door, he was a lot more comfortable. And I think the only thing that really changed was that he had, more sure footing. And so let's just reconsider where we examine them. And I'll show you one of my favorite exam rooms. It's on the next slide, and there it is in the owner's car. Hey, you can expand your hospital. Just move yourself out into the owner's car and do the exam right there. So again, we're getting a blood pressure, and look at the characteristics. We've asked the owner to play classical music on the way into the hospital, because we know that classical music is soothing for pets. We talked about that. We've got the pet in a car that it's used to, a comfortable environment. It's a non-slip surface on the back seat there. So it's got all of the characteristics of really the ideal exam room, and we can do a lot of the things that we need to right there in the back seat of the owner's car. And owners, again, are really appreciative of any effort that you take to address the pet's anxiety levels, and this is one of the obvious ones. And remember, if we're doing some things in the back of if we're doing some of the exam in the back of the car, that can avoid coming into the hospital. We looked at a statistical perspective of fear, anxiety, and stress, and we realized that 77% of pets didn't like entering the hospital. So why do they have to? Why can't you do what you need to do in the back seat of the car? Every case is a little bit different. Okay, next slide. So we need to instruct all of our pet owners to bring their pets in hungry. And we use food at our hospital all the time. I'll show you a picture of our hospital. Remember that when you walk into my hospital, most pets don't want to walk in there, 77%. They don't want to be in the waiting room, 60 to 73%. They don't want to be in the exam room, that pet guardianship study. Well, when you walk into my hospital, you walk in, you get a treat. You step on the scale, you get a treat. You walk into the room, and there you see right there, there is a bowl of treats waiting for you. So we just laminate these little placemats, and with a dry erase marker, we write welcome back, Chloe in this case, and there's a little bowl with food treats in there. Owners will tell you that you're spoiling their dog. And I'll say, yes, I am. But really what I'm doing is I'm conditioning their dog. I'm trying to create this environment which is so ideal for these pets. And some of you are probably going, oh gosh, Bloom, hurry up, get to the end already, get to those jewels, those take-home messages. Well, look where we are already. We've gone from pets who don't want to travel or enter a veterinary hospital. They don't want to be in the waiting room. They don't want to get weighed. And just by bringing them in hungry and offering them food, we have pets who pull owners into our hospital. They start crying and wagging their tail and trying to get to the door of the car as soon as they hit our driveway. They can't wait to get inside. They pull the owners in the front door. The dogs run and they jump on the scale, and then they pull the owners into an exam room, and it's the owners who are lagging behind. And that is a very powerful experience for pets and pet owners. And you are perfectly set up to do some of the routine or urgent care procedures without having to come to fear, anxiety, and stress yet. So every room that you see there has a buffet of food. You've got hypoallergenic options. You've got freeze-dried options, beef and chicken. In the middle, you've got some pasty options. Kong paste come in liver, chicken, peanut butter flavored, bacon and cheese. You have a lot of options there. And then you start getting creative with these, which you'll see in the next slide here. If you want a social media moment, you just take that Kong stuffing or squeezed cheese and you spell the pet's name. This pet's name is Max. And you put that on your table. That is a picture that owners love. They'll laugh, they'll take pictures and think you're a hero, and that's what goes up on Facebook. But you can also do an entire exam while that pet is eating its name. So that's a Jack Russell. You can only imagine, and I am going to generalize, but we all know that Jack Russells tend to be a little bit hyper in the exam room, a little bit skittish, a little bit reactive when you give them needles or shine lights in their eyes or take a feel of their bellies. If they come in hungry and you put their name on the table or you draw a little happy face and let them eat their name and keep them doing that through the course of your consultation, you can do the entire exam and they won't even flinch. And then they leave and all they think is, wow, I came and got some treats, and they missed the exam part and they missed their vaccines. At least they think they did. So what a great experience for pets. So that brings us to the next part, and that's about vaccines. The most common thing that we do in veterinary medicine is vaccines, and so I want you to choose your vaccines wisely, and let's just generalize for a moment and talk about any injection. Vaccine is the most common, but it can be any injection that you give in your hospital. There are three things that I want you to think about. One, I want you to change the needle before you vaccinate. And let me just explain this, or before you give a drug. So vaccines, you take your needle, you put it in the diluent, and it goes through that little cork or stopper of the container. You pull the needle out, and then you put the needle into the cake or the freeze-dried part where the vaccine is, the good stuff. You take that needle out, so it's gone in and out now twice. You shake it up until it's all homogeneous and warm and in your hand, and it's all been diluted out or rehydrated. You put the needle back. That's the third time. You draw it up into the syringe, and then you're going to go vaccinate the cat, and so or the dog. And those needles do dull for sure as you go. And so, and there's studies that document how those needles get dulled. Just change the needle and tell the owner, hey, I'm going to change the needle to the very smallest needle that we have in veterinary medicine and that we have in this hospital, because I really want this to be a comfortable experience for your pet. And that goes for all the injections that you do. The second thing I want you to think about, and it seems so obvious, and yet we just don't do it. And for those that are doing it, very rarely are they doing it with consistency, and that's something called the touch gradient. So if you've ever worked with horses, for sure you've done this. When you don't just walk into a stall and pick up a horse's hoof. I mean, they'll just kick you, and you'll be in the hospital. You start with something more neutral, something around their neck, around their mane. You work your way down along their shoulders, down along their chest, along the thorax, along their flank, down their thigh, down their leg, and then you ask to pick up their hoof. You don't just walk in there and grab the hoof. We need to do the same thing with dogs and cats. We need to start somewhere neutral, around the chest, around the back of the neck, and work your way down the chest, down the flank, down the hip, down the leg to the hock where you're going to give your vaccine, or if you're giving it on the side. All too often, we just pick up a scruff of hair and we ram in that needle to give sub-Q fluids or give the vaccines. Work with the touch gradient, start somewhere neutral, work your way through. When you get there, just apply a little bit of pressure to desensitize it, and then put your needle in that exact spot. And rarely will those pets even flinch. And so the third thing, in addition to changing the needle and the touch gradient, choose your vaccines that you use very wisely. So the next slide, please. There are some really great new technology that's out there, these half-mil ultra vaccines. So this is neat, and you get to tell owners, hey, I'm going to protect your pet like I have in years past, but the good news is I only have to use half the amount of vaccine that I used to use because of this newer technology. And these vaccines, the typical vaccines that you use are 1 mil. These newer technology vaccines are half mil only, and owners really appreciate, for sure. Like, I talk a lot through my exams, and I talk about things like insurance and nutrition, and owners are happy to hear what I have to say. But almost every time that I say we're going to vaccinate your pet like years past, but I only have to give half the amount, they will almost 100% of the time stop and say, you know what, I really appreciate that. That makes me happy, because that's what owners are reluctant to do, right? They're worried of vaccinating their pet, and you tell them the steps that you're doing to reduce the amount of vaccine, they think you're a hero. Does a half mil make a difference? It sure does, and it makes a big difference. A study done in Denmark about 10 years ago, they injected people with saline in their thigh, and it was a double-blind study. So these syringes, the person receiving the saline injection and the person giving it, they didn't know how much was in the syringe. They were just labeled A, B, C, and D, for example. And then they were injected with 0.2 mils, 0.5 mils, 1.0 mils, or 1.5 mils. And very significant difference in how people perceived those injections. People receiving 0.2 and 0.5 mils consistently reported a much more comfortable experience than people getting 1.0 and 1.5 mils of saline injected. And so, yeah, those volumes, it makes a huge difference. And so if we use these half-mil vaccines, we're in much better shape at providing great experiences for pets. And remember, we don't want to scar their amygdalas. So, because once it's in there, they're scarred and they never forget. And so if we can vaccinate those pets with half the amount, then they're going to have that much greater an experience. The other thing you need to do is take a look at the vaccines that you are giving. Elanco has these vaccines, these ultra vaccines. They're half-mil vaccines, and they have them in just about every combination that you could ask for. So instead of injecting these cats and dogs with as if they were a pin cushion, you can get the DA2P vaccine, you can get a lepto vaccine, you can get a DA2P lepto vaccine combination. Same with the cats. You can get the FARCP vaccine, you can get a leukemia vaccine, you can get a combined vaccine, all half a mil. And also, when you start looking at lepto and Lyme disease, if you can find vaccines that have the combinations that you need, all the better experience for that pet and pet owner. So if you can get a combination of distemper DA2P with lepto DA2P with Lyme, a lepto Lyme combo, you just need to know what the risks are in your area geographically, and if you have ticks and you want to vaccinate for Lyme disease, find something that's in combination, and your reps can certainly help you through that. But just bear in mind, here's the take-home message. Give half-mil vaccines because it's a more comfortable experience, and try to find combinations of vaccines that fit your pet's needs, that you can protect the pet and reduce the number of injections that you have to give. And then my favorite vaccine also, next slide, is the one that doesn't even require a needle at all. And these are these kennel cough vaccines. I love these vaccines because if you can give a vaccine and tell an owner we're going to vaccinate your pet and we're not even going to use a needle, we just have to give a squirt in the mouth, man, you got to tell them about it or they'll think that you forgot to vaccinate their pet. It's that simple. And what a great experience for pets. So you can get creative with this. We talked about using food and bringing them in hungry. So what would it look like then if we took this vaccine, loaded it up into a syringe, took off the needle, and then knowing that they're hungry, we put the Kong paste or squeezed cheese on the outside of the syringe, let them lick up that stuff off the syringe, they'll come running to their vaccine. You just tilt that needle into their cheek pouch after they're done licking everything, squirt it in their cheek pouch on the mucosa, because these are these oral transmucosal vaccines, and they are done, and nobody even knows. I mean, the catch is, the downside is, you really have to make sure that you tell owners that you're vaccinating them, what you're doing, because they will miss it. It's that simple a vaccine. Okay, next slide. I want to move on to topical anesthetics. So now we're getting more into blood collections and IV catheter placements and some of the emergency stuff. And again, these are the building blocks, right? So when we're taking blood samples, we're going to be giving them food because we brought them in hungry. They're going to be on a non-slip surface. They got music playing in the background. They've got all of those building blocks are there. We use EMLA all the time in our practice. So any topical anesthetic will work. This is what we have available in Canada. So it's a prilocaine and lidocaine mixture. We'll just rub that on the pet's hair, on their arms, over the cephalic veins or saphenous veins, wherever we're taking the blood sample from. Then we wait about 20 minutes and they're numb and they don't feel even that needle poke half the time. Another option you see here in the next slide is the spray that you would use for cats. And again, this is off-label, of course, but you would spray their larynx before you intubate them to prevent laryngospasm. These lidocaine sprays, these are non-aerosolized sprays. You just squirt a couple of squirts on the skin, wait about a minute or two, and you will see a very different experience when you take blood samples. And again, we're going to use all of our building blocks. We're going to be having classical music playing. We're going to be giving those pets food as we take their blood sample. We're going to be using our touch gradient. They're on a non-slip surface. We're numbing their skin. And all these little things add up to a very flawless, comfortable blood draw, or IV catheter placement, by the way. Okay, next slide. Similar to placing those IVs, we also have to get those IVs out. And the problem with removing IVs, how many people like going to get waxed? It hurts, and you put wax on and you pull that wax off, and all the hair gets ripped out of your skin. It's an uncomfortable experience. People who get their eyebrows waxed certainly know that, and their arms waxed. They do it because it looks good, but it's not a pleasurable experience. And I don't think it's any different when we remove IV catheters. We tape those things in so much. We've got tape wrapped around their arms in every which way, and when you cut that tape and pull out the catheter, you look at the inside of the tape and you can see all the cat's fur in there every time. And so there's a great product that we use for a lot of our IV catheters called Ease Off. You just spray that on the outside of the bandage, and it does something to break down the adhesive on the inside of the bandage. And when you pull that catheter out, that tape just falls off the arm like butter, and there'll be no hair attached. And again, you don't want to scar those amygdalas, so you create those great experience. Next slide. And the easy thing that we always forget about, just because we've been doing everything the same way for so many years in veterinary medicine, you've got those cats that are in the hospital on IV, and you want to take those IVs out. You go in there, the cat's hiding under the blanket or hiding behind the litter box, and you're trying to get those IVs out. Not only will it be uncomfortable for them, but they really want nothing to do with you because they've been in your hospital for 3 days and you've done everything you can to create great experiences, but they're still a little edgy and they've been sick. Instead of, if you go to approach them and they sort of retract to the back of their cage because they're afraid, you've got the IV sticking out of the cage. Just give them a little bit of Propofol. My texts call this a dizzy dose of Propofol, again, off-label. We give about 1 mg per kg from the outside of the cage, and then we open the cage and go in and get the cat. That's a whole lot different than going in there and the cat's scratching at you or hiding at the back of the cage, and you got to get the towels and get the gloves and pull that cat out and rip its hair off as you pull out the IV and hope you don't get scratched yourself. So owners upstairs, somebody forgot to, they came earlier than you expected, and you think, oh gosh, how do I get this cat off IV in a hurry? Just drop a dizzy dose of Propofol, take the cat out of the cage. It'll be mostly, if not completely asleep for about 90 seconds. Take out the bandage, take out the catheter, put a little wrap on there to prevent any bruising as you usually would, and cat's ready to go in about 2 minutes to the owner upstairs waiting to pick it up. Easy. The dose for Propofol for unpremedicated pets is about 8 mg per kg. If they're premedicated, it's about 4 mg per kg. And again, my texts call it a dizzy dose, 1 milligram per kilogram. For a cat, it's like half a mil. So simple of the 10 mg per mil concentration. Okay, next slide. I'm going to go through just very quickly my favorite pharmaceuticals because I think a lot of you have heard this stuff before. We use a lot of trazodone in our practice. I'd say about 1/3 of the dogs that I look after come in on trazodone. And you can do a little reality check. If you say, I know all about trazodone, I'm already using it in my practice. If you're got the same bottle of trazodone that you had 2 years ago, then you're not using it enough. Again, about 1/3 of the pets, so 1/3 of the dogs that I look after are on trazodone 2 hours before they come in. Trazodone is a serotonin antagonist and reuptake inhibitor. I'm not going to get into great detail as how these work right now. I'm going to be speaking at VMX next week, so January 19th, and again at Western in Las Vegas on February 18th, and we're going to go through this a little bit in greater detail then. Or you can speak to any of the anesthesiologists in your neighborhood or behaviorists. They'll tell you all about these drugs. But it has a calming effect. Serotonin makes you happy. It increases the happy chemicals in your brain because when those receptors are stimulated, that's what happens. But it does something else, and it blocks one receptor that makes you really happy or excited. and that is the 5-H2A receptor, and that's really the one that we're hitting on when we give these higher doses of trazodone to pets 2 hours before their appointment. And if you block that excitation receptor, then those pets are just chilled and calmed down quite a bit, and not really sedated. It doesn't seem to inhibit their learning. They just come in without their edge, and it's a much better experience. Owners will tell you when it works, they know it, and they'll say, I never want to come back here without using trazodone. So the dose we use is 3 to 8 mg per kg, and you can go up as high as about 14 mg per kg. There is a suggestion that you should never exceed 300 milligrams total dose, and I think that's just because there isn't much data out there to support it. Rarely will you need to have to get up that high anyways. So a third of our pets are on trazodone before they come in, 2 hours before they come in. So our next slide, if you want a more natural alternative of something that stimulates serotonin or increases the happy chemicals, the neurotransmitters in your brain, L-tryptophan, and there are various foods and treats that have this in them. They take longer to work. You don't want to just give a dose the night before. You might want to start a couple weeks before. We'll use this for anxiety at home. L-tryptophan, so milk protein is where it's coming from. Milk has two main proteins, casein and whey. The whey protein can be broken down into peptides, and the peptides are made up of amino acids, and the amino acid called tryptophan is one of the building blocks or a precursor for serotonin. So you find products that have a lot of tryptophan in them, and you can presumably increase the serotonin in the brain. You'll find tryptophan in eggs and some meats, particularly turkey, and that's why when you have Thanksgiving, everybody's all chilled and relaxed at the end of dinner. It's probably the tryptophan in the turkey. Okay, next slide. For cats, we hit on the GABA receptors, and GABA, and by the way, you do this a lot in practice anyways, because that's where your Valiums, your benzos work. They hit on the Valium receptors, or sorry, on the GABA receptors. And GABA is an inhibitory neurotransmitter. So that picture on the top right there of the speed skater going around the track, I want you to think of that as a long race at the Olympics, and the guy, the coach that's sort of crouching there yelling, slow down, slow down. That's Coach GABA. He's slowing the skater down because he's afraid that the skater is going to burn out and not be able to cross the finish line. Pace yourself, slow down. That's how the GABA works. So when you give something that stimulates GABA or excites the GABA receptor, you are causing the body to slow down or be inhibited. So we use gabapentin for pain relief in cats. The dose that you're using is about 5 to 10 mg per kg, which for an average cat is 25 to 50 milligrams. And that's what you're doing. You're inhibiting the pain. You're blocking the pain sensation as it ascends up the spinal cord to the brain. We'll use that dose, again, off-label, at not 25 to 50 milligrams. We'll use it starting at 100 milligrams given 2 hours before the pet comes to the hospital. And we'll use this, again, just for routine exams, for vaccines when they're sick. Even the cardiologists are now using this for pets that need ultrasounds. They don't want those pets stressed on their tables as they do their echoes, and so they'll give gabapentin to those cats frequently now too. So an inhibitory neurotransmitter. If 100 milligrams works, great, perfect. That's what we'll do every time the pet comes in from now on in. If it works but not great, then we'll increase the dose next time to 200 milligrams. And if that's working pretty good, but we think we can do better, sometimes we'll go up to 300 milligrams per cat. And so it seems to be very safe. And again, probably about a third, even maybe a little bit more of the cats that I see in practice come in on gabapentin. If you want a natural alternative, you'll see that on the next slide. We'll use alpha-casazopine. So we talked about milk proteins having The two main proteins are whey and casein. From the whey protein, we get the tryptophan as the serotonin precursor. From the casein protein, you break that down into peptides, and one of the peptides is comes these casazopines, and you'll find these in treats and foods, and also some great products like Zilkine will have this, and that is a natural way to cause this inhibitory reaction or stimulate the GABA receptor and inhibit the cat. So we'll use these things, for example, when pets come in for boarding. We might start them on an alpha-casazopine a couple of weeks before. We'll use it before pets come in for dental procedures. We'll use it before pets come in for boarding, and just to take the edge off of them a little bit. We'll use it for dogs and cats. Just be aware that you have to use a higher dose, or I recommend that you use a higher dose off-label than what's on the bottle. You have to get up often around 30 to 40 milligrams per kilogram. So for the average cat, we're using 225 milligrams once a day. Okay, let's get into my favorite injections. We'll start with a little transition one here. We'll go back one slide. Yep. So we're going to start with dexmedetomidine. So you all know how to use this as an injection. I use it a fair amount in my practice as an oral transmucosal sedative or anxiolytic. And so, yes, this is the injectable product that I draw up into a syringe. I take the needle off and I squirt it in the pet's cheek pouch. And the dose I'm using is 10 to 25 micrograms per kilogram OTM. That's oral transmucosal, just like my favorite vaccine, the Bordetella vaccine. And I give it 20 minutes before the visit. So I have the owners arrive early, make sure that the pet's been doing well at home. I get a history, and I'll even have the owners squirt this in their pet's cheek pouch in the car. So these are for the much more anxious pets where the music, the non-slip surface, the trazodones maybe are helping, but still aren't enough. And so we'll squirt that in the cheek pouch. Why such a high dose? Because 10 to 25, when you give it oral transmucosal, only about 1/3 of it is bioavailable. So 10 micrograms per kilogram, a third of that is about 3. That would be equivalent, in 25 micrograms per kilogram, a third of that is bioavailable, so that's about 8. And 3 to 8 micrograms per kilogram is about what you've been using for your injectable dose. So there's a nice little way to take those pets down a little bit for those really anxious and sometimes aggressive dogs. My favorite injections that I use are here on the next slide. So dogs, I love mixing butorphanol 0.2 to 0.4 mg per kg, and I'll mix it in the same syringe with acepromazine 0.05 mg per kg, and I give them IV. This is how we take most of our x-rays in our hospital. We'll talk about that in a minute, but I'll do this for some exams. I'll do it for some of my fine needle aspirates. This is how I do a lot of my anal glands. We'll just bring the dogs down a little bit with this combination. They'll sleep it off over an hour or two, and then they're good to go home. For cats, my favorite combination that I use is butorphanol, 0.2 to 0.4 mg per kg. I mix it with acepromazine, 0.05 mg per kg, and I add in a tichiketamine at 20 to 25 milligrams per cat, not per kilogram, per cat. And I mix them all in one syringe and I give them IM, because on those really anxious cats or fractious cats, it's hard to get a vein on them without stressing them more. It's easy to get a muscle on them. And so we'll just pop them in the rear end with that injection, and just in about 3 or 4 minutes, they are putty in your hands, and you can do anything that you need to in terms of x-rays, getting blood samples, doing your vaccines. These are the cats that you can't get near, that you need to do some stuff with without stressing them or your staff out. You can add midazolam if you want. I'm doing this a lot less lately because, one, I just find that they don't need it, and two, sometimes they wake up with this midazolam excitement and you see them just bouncing off the walls of the cage. And so I've really moved away from it, but I wanted to include it there so you could take a look at it. Okay, next slide. So We've talked about some of my favorite pharmaceuticals. Here's my experience as I travel to clinics and talk about people, because I hear a lot, oh, I know Bloom, I know these injections. Yep, I use them all the time. Some people say they work, some say they don't. And then when I dig a little bit deeper, what I find is that they're using it at really wimpy doses. And here's the problem with everything that we're talking about. If you do it in a wimpy way, you are actually causing harm. So I want you to look at this house, and this is what I want you to think about next time you're calculating drug doses. On the left side of the house, it's an inferno. You have lost everything good on that side of the house. On the right side of the house, it is salvageable. There is some valuable goods, mementos, pictures, belongings that you can salvage if you act appropriately. If you don't act appropriately, if you are wimpy putting out that fire, that fire is going to spread. You're not going to put it out, and you are going to damage everything in that house and lose it all. And it's the same with our pets who are coming in with fear, anxiety, and stress. If they need to have medications to settle them down, and you start off too wimpy, you are going to lose it all, because they are going to escalate if you don't get on top of their fear, anxiety, and stress completely. And so start with the building blocks that we talked about. Add the pre-visit pharmaceuticals, so those trazodones and gabapentins, the natural products if you want, the alpha-casazepines and the tryptophans, and then add in your injectables when you need to or before you need to. But do not let those pets escalate where their fear and anxiety are increasing, and you can see it happening, because you will scar those amygdalas. We keep talking about the amygdalas, and then they won't want to come back. And that's why 77% of those pets don't want to come into your hospital, 63% don't want to be in the waiting room, and 46% of the dogs and 79% of the cats don't want to enter your exam room. And so you see how it comes full circle from beginning to, well, this isn't even the end, but you see how it all builds up and how it comes right back at you. It's from the experiences that we created. So please don't be wimpy when using these medications. I know at the end of this presentation, we're going to do some questions, and someone's going to ask me about pets with heart disease. And, is it safe to use medications for pets with heart disease? I don't want to medicate them because of their heart disease. Just remember that when a pet comes to you with congestive heart failure, the first two things that you're always taught to do, the cardinal rules, give them oxygen and calm them down. So I would argue that the pets with heart disease are probably the ones that we need to be on top of most, because again, if you're wimpy, those pets are not going to survive the stay in your hospital. They'll get so stressed out that their heart failure will be the end of them. So next slide, please, Jess. So remember this, the bringing them in hungry, the gabapentins and the trazodones, the music, the non-slip surfaces, the scheduling. Next time you have to do the injections, the oral transmucosal dexmedetomidines. I use that in dogs, by the way, not in cats, the OTM dexdormitor. Remember that next time you're doing a nail trim. Remember that next time you're trimming a hot spot. With x-rays, we sedate every single pet in our hospital to the extent that they do not need to be supervised in the room or held in the room while we take the x-ray. Those pets are sedated heavily enough, and we're not talking about some of the pets, we're talking about all of the pets, with the exception of those that are so sick and moribund anyways that they don't, they're hardly moving. But pretty much all those pets who are here for vomiting, abdominal pain, heart disease, kidney disease, whenever we need to get an x-ray, we are giving them something that we can put them in a trough, a foam trough, or lie them in lateral recumbency, just gently pull their legs apart with ties or ropes or tape and sandbags or bean bags, and we step out of the room and they don't move, and it is such a beautiful experience to watch happen. And we're talking about thousands and thousands of pets over the last couple of years that we've done this with. We get much better quality x-rays. Our staff aren't exposed to unnecessary and harmful X-ray scatter. Our X-rays are a lot faster to take because we don't ever have to take retakes because the positioning is always perfect. It's a much better quality X-ray, and most importantly, or equally importantly, is that the pets have a great experience. And can you imagine coming to your hospital as a pet because you're sick, and then you have to be put on your back in a cold room on a hard table, held by strangers, pulling your legs in 4 different directions for an X-ray at a time where you're at a time of your greatest need, when you're not feeling well. And that's what we do. We can sedate these pets, and it is the nicest thing we can do for them, I think. And so we do it all the time. And we even use those sedations when we do our anal glands. Hey, I know it's just a 10-second procedure. They're just coming in for vaccines and have their anal glands done. Ever wonder why those pets don't want to come in for vaccines anymore when you're doing their anal glands? Because they don't like having your fingers up the rear end squeezing those little sacs. And so I know that's how we've done it, but if we can just bring those pets down and de-escalate them so that they're calm, we do their anal glands, they wake up and they go home, and it's a much better experience for pets. Okay, next slide. We're coming close to the end here, folks. Want to talk about ear care. So next slide. Whenever we look at ears, I always think about this picture. If that were my son or daughter who fell off their bike and they came home with a wound like that, all the parents who are on this webinar listening know that you're not going to touch that. You're going to look at it carefully. You might dab it a little bit, ever so gently. Your child's probably going to cry as you do. And you're just going to dab some cream on that because you do not want to go near it. It is so red and raw. We are all sensitive enough to know not to go near that for our children's sake. Next slide. That's what it looks like on the inside of a dog's ear, the same redness. And what do? We take that red, with our child, we won't touch it. We just look at it from a distance. With dogs, we dump stuff in there to clean it out. We put these hard plastic scopes in there and dig around in there to look around. We stuff Q-tips in there to take samples. What is the difference? Why would we be so much more sensitive for our pets, or sorry, for our child's poor elbow when they fall off their bike and have inflamed red painful skin? But for dogs, we sit there and squeeze it and poke at it and prod at it and take samples of it. I'm not saying we shouldn't do these things. I'm just saying those pets need to be sedated. We have to get out of the habit of treating these pets as quick outpatient procedures where we take a swab with a Q-tip, we stuff stuff in there to clean it out, then we massage the ear, we put our fingers there and ream it out, and then we start stuffing medicated stuff in there, and then we ask the owners massage that canal, push on it real hard to distribute the medication. We need to find kindler, gentler ways of doing it, and it starts with their first visit when they come to you with their painful ears, that we need to sedate these pets and give them some anxiolytics and give them some pain relief before we start digging around in those ears. Because if we don't, and again, I know we all do it or used to do it as outpatient procedures, if we keep doing that, we keep scarring those amygdalas, and then they keep not wanting to come into our practice, and then they keep not wanting to get vaccinated, and they keep not wanting to come to us when they're sick, and they start looking for healthcare advice elsewhere. And veterinary medicine becomes the stop of last resort because we scarred their amygdala. Okay, next slide. Eye care. And so we'll look at this next picture. Again, we're just putting in eye drops. It seems so simple, but if we bring them in hungry and we treat them when they're hungry, we can just, in my right hand there, I've got a treat that the dog's about to take from me. I'm examining that pet where it wants to be, on the floor rather than on the table. We've got music playing in the background, and what's sort of unique to this is we're going to use, again, touch gradient. We'll start near the shoulders or its back, and we'll work our way up, and we'll work from behind his eye. almost every time I see people approach dogs and cats with the bottle, treating their eyes from the front, and the pet sees the bottle coming towards them, and they don't know what it's about to happen. You just distract that dog with a treat. Put the treat in front and put the eyedropper behind. You want to get a little bit creative? Take that Kong paste or the squeezed cheese, Vegemite for cats. Cats, by the way, love olives and shrimp, apparently. Marty Becker swears by whipped cream in ice cream cones. We can't use that because we can't keep it refrigerated. We don't have enough fridge space, but you just find what works and you get a buffet of foods to try. And so we'll just draw something cutesy on the wall, a happy face and Kong stuffing here, and then I'll just work my way up the dog's back to the back of its to its upper eyelid from behind. You can put those drops in, no problem, and that's a lot better than wrestling with these guys. I want to switch briefly to in-hospital care. We admit these pets to our hospital a lot. Again, this picture is from Heather Lewis of Animal Arts in Colorado. And this is sort of the ideal bank of cages for cats. And I just want to take a look at it. I'm not saying you have to get these cages, but I think there's a lot of things going on here that we need to at least appreciate, and then we can deviate or modify our existing hospital from there. So these are multi-level cages. Your cats can jump from the first level to the second level and up to the third level, and because cats like being high and dogs like being low, and so I know we always take dogs and we just put them right up on the exam room tables, but they prefer to be lower down to the ground. And cats, they like their climbing structures. They like to be on the top platform. They like to be up high. And so I like that. These cages all have little privacy screens, and also you'll notice that the bars are horizontal, and presumably because the eyes are positioned on the head horizontally, you can look out if you're at the right level and never see a bar in front of you, so you don't feel like you're being nearly as contained or trapped. And because what pet really likes to feel trapped in your hospital. So let's look at how we can modify this in our own hospital if we don't want to do a major reno. So here are our existing cages. So we put our dogs on the bottom. We've got non-slip surfaces in the cages. Again, we're trying to stay away from the whites if we can. I think this is an older video and we have some white towels in there, but we don't use those anymore. We put our cats up on top. We don't have dogs and cats looking at each other. We don't have dogs looking at other dogs. We don't have cats looking at other cats. Everybody's facing out, and we're on those non-slip surfaces. Again, dogs on the bottom, cats up top, something to think about for our hospitalized pets. And we'll go to the next slide. And we'll put these very expensive and unique privacy screens, just a towel. So we'll hide that over half of the cage so that if a cat or dog wants to hide and not have that sensory overload, then they can go to the left side of the cage. And if they don't want to hide, they can come out to the right side of the cage. And a little bit more advanced in the next slide. So these are our dog runs. We put in hockey glass. So these are shatterproof and they're clear. And any glass, you just speak to people who build these clinics, and you get a shatterproof, easy to clean glass and durable glass. And so the dog on the left behind the pink blanket has a privacy screen. The dog on the right is there, likes to look out, and there's no chain link or bars there, so they feel like their room's a lot bigger than it really is. And then on the counter on the bottom right, it looks like we have the ICOM dog music playing that I told you we had in all of our dog wards and cat wards. And again, a much more peaceful and beautiful experience. And hey, it doesn't sound like much to do this, and it really isn't, but it makes all the difference in the world. It makes all the difference in the world. Now, let's look at the next slide here. Let's talk about how this plays in. So think about pets recovering from surgery at your hospital. So we all know that we have to give them pain relief, but it goes beyond that. Think about the warmth that you have to provide. It's not just about keeping their body temperatures up, because that's what your regulatory, governing body tells you you have to do, and that's physiologically the right thing to do. Imagine having a spay or whatever, an exploratory surgery, and you have this abdominal incision, and then you wake up and you're shivering because your temperature is too low. And nobody likes to see that, but shivering means that your muscles and your skin is all contracting, and it's contracting right along that spay or surgical site, which has to be the most painful thing you can ever imagine. And so it's not just about providing pain relief, but also making sure that we don't cause those muscles to be used unnecessarily through shivering. So really important that we keep them warm. A lot of these dogs and cats will empty their bladder before they wake up from surgery because we've pumped them full of IV fluids throughout their surgical procedure, and they do not want to wake up with a full bladder and feel that they have to go pee right away. These dogs are just recovering from major abdominal surgeries or any surgery, and to ask them to have to go out and urinate, go up the stairs and go outside and pee is really an unfair thing to do. And so we'll empty their bladder after surgery. And again, the non-slip floors that we talked about and the noise reduction. So this is a global thing. This is not just attending to this pet's needs, but every pet in our hospital has to be attended to. The other sick pets, the boarders, the pet that's having a nail trim, the pet that's just visiting, they all have to be addressed either through the nutraceuticals, the trazodones, the gabapentins, the injections, the privacy screens, and we're going to talk about how you actually do this at VMX and Western. I mean, I'll show you videos galore of what these things look like that you'll just blow your mind. But you have to make sure that every pet is attended to, because you don't want them to ruin this guy's recovery. And the last part we're going to talk about before we wrap up this webinar is the point of communication. So communicate, communicate, communicate. How do you make this happen in real practice? Well, it all starts right here with our reception. They have to tell those pet owners, hey, we're going to see you at 9:20 on next Tuesday. Make sure you bring your pet in hungry. Skip breakfast that day so that we can give lots of treats while he's here and really make him love coming, because we want to give him a treat when he walks in the door. When he gets in the scale, we're going to have treats waiting for him in the exam room when he walks in. We're going to give him treats as we do his vaccines and as we check his ears and his eyes. We don't want him to we want him to be hungry when he gets here. And don't forget that your veterinarian has dispensed for you already a pre-visit pharmaceutical. I see here in the file that Ripley's supposed to be on trazodone, so don't forget to give that 2 hours before his appointment. And I also want you to know that he's coming in for a vaccine. And at this hospital, we're using a new technology vaccine. We're going to vaccinate your pet like we've been vaccinating in years past, but we only have to use 1/2 ml because we're using these new ultra vaccines. And so we can provide great protection with half the amount of vaccine. So it all starts with education and communicating to clients. It might be that they're coming in for just a kennel cough vaccine, and you can tell them, we can't wait to see you at 9:20 next Tuesday. We're going to give your pet a vaccine. It's needleless. It's a squirt in the mouth. It's going to be the best thing ever for your pet. Okay, next slide. We also send home and a sample on the left side. You can get that off a website. You can collect a hard copy of it. We can email it to you. And these are tips and tricks for traveling to the veterinary hospital in a calm state of mind. You've heard that ad nauseum over the last 3 years. If you haven't, just attend any fear-free symposium or any fear-free tract at any of the major veterinary conferences, and you'll hear it. There's usually somebody talking about that somewhere. And on the right side, we also have a document. It's part of our consent form. When you bring your pet to our hospital and we're admitting it, whether it's for boarding or for x-rays or for IV fluids because your pet has pancreatitis, if your pet is staying at my hospital, you're signing that form. And what it says is we want your pet to have the best experience imaginable. And to do that, you authorize us to use natural products and like the Zilkines and the nutraceuticals, or traditional pharmaceuticals like the trazodones and the gabapentins, and several other techniques that we might have that are available to us, including sedation, that you authorize us to uh, keep your pet calm during its stay, because we really want them to be comfortable and fear of anxiety and fear of stress. And so we want them to have a great experience. And even for those pets where it's intuitive, they're maybe already calm, or they're coming in for x-rays and they know their pet's going to be sedated for x-ray. So it seems redundant. We still have them sign that. And then we just point out, well, I know it's not something that your dog is going to need, but no one comes in without signing this form, because it also assures you that the big dog down the hallway who would typically be barking, his owner also signed the form, and will be attending to his needs so that he doesn't ruin your dog's stay. And owners, again, are really appreciative of that. And then the last part that I'm going to talk about today briefly in communication is the emotional health record. And this is how we communicate with each other within the veterinary hospital, because we've amassed this huge amount of knowledge for each individual pet, whether they like where do they want to be examined, on the bench, on the floor, or on the table. Do they like a room that has a window looking out, or they're dog aggressive and they want to be in a back room that doesn't have any windows? Do they um, uh, music works or music doesn't work for them? Are they on trazodone, and what dose did we use, and did it work, and should we try a higher dose next time? And all of that information gets sort of created over several visits, and you don't want to read back when you only have a 15 or 20-minute appointment. You don't want to read back through 3 years of history. And so just like you have your physical record, where it says your master problem list, where it talks about torn ACL and allergies and heart disease, we also have an emotional record, and every software program has a place where you can stick this in somewhere. And it's a living document, you can always change it. And so we have a part about client education. What has somebody told these people? Well, always arrive hungry and condition to a compression shirt. We didn't talk about compression shirts today. We can't cover everything. Known fear, anxiety, and stress triggers on the right side there. Well, he's head shy and he's wary of strangers and other dogs. So now we're start thinking, okay, put him in a room where he can't see other pets. If he's going to be admitted to the hospital, put up a privacy screen that we talked about. Where's his preferred exam location? Well, he first to be examined on the floor, and use room 2 because there's no windows. So long gone are the days where you just pick him up and put him on the exam room table, because we know now that he doesn't like to be up there. And we've talked about examine them where they want to be. What distraction techniques does he like? Well, he loves the freeze-dried liver treats. He does not like the soft pasty Kong treats. Or maybe he likes the liver, but not the bacon and cheese flavor. And so we know what that pet likes. What pre-visit pharmaceuticals have we used on that pet? The trazodone works okay at 25 milligrams. Next time we'll try 50 milligrams. And when we come back, if that works great, we'll just wipe out the 25 milligrams works fair, and we'll amend that to say trazodone 50 milligrams is great for this dog. And if we need to give them some sedation for certain procedures, like an anal gland or checking its ears, butorphanol 1 milligram is all you need for blood collections or ear cleans and things like that. And so all of that information is right there. And these are the little building blocks that all amass together to make this beautiful piece of artwork, this well-crafted, beautiful document and mastery of coming to your hospital. So when that pet comes for its anal glands, you can look at that right there, and you already know. Bring him in on his trazodone. We're going to give him 1 milligram of butorphanol. We're going to do this on the floor, and we're going to do it in the back room because he doesn't like seeing other dogs. If we're going to admit him to your hospital, all of that information is there to help you create that great experience. And these are the things that we need to think about. These are the things that we're going to be thinking about. We can go to the next slide. As we work our way through all the procedures that we're doing in our hospital, vaccines, x-rays, surgery, there are those magic jewel or those wonderful take-home messages, but don't forget those building blocks, because all those building blocks work up to a very powerful statement and create these great experiences for pets coming into our hospital. If you want to take a step back and know if you've been successful doing this, all you have to do is watch pets. If they're coming running through your door and they will not leave your hospital, you have to carry them out to the car because they refuse to go, then join me on the ride because you're there. If you're seeing pets trembling coming in, they're showing all those signs of hiding, you probably did those nail trims, the anal glands, the vaccines, and you did them sort of an older fashioned way. And if we could just start implementing these things in our practices tomorrow, and you can, they're all simple, we can really create much better experiences. On next January 19th on Saturday at VMX, we're going to be looking at some other tips and tricks and magical moments for Fear Free, and I'll show you a lot of videos of how this stuff all works and some things. We're going to kick it up a whole nother level as well. This is just the basics, and if you can't be there, well, join us at Western in Las Vegas on February 18th, and we're going to be doing a similar presentation there. I'm going to end it right there. It's a Friday afternoon, but I'm here for any questions that you have. I hope you've enjoyed it, and I really, really hope that you can take this back to your practice and really make a change. Your staff will love you. Your clients will love you. The pets will love you, and you'll love yourself even more, because it is a very different experience when those pets come in and are licking your face every single time rather than running away from you. All right, I'm going to take some questions.
Awesome. Thank you so much, Dr. Bloom. So some of the questions that came through, the first is, how do you deal with the same day urgent appointments with smart scheduling?
All right. So the schedules, remember, an emergency is an emergency. They're going to come in when they have to come in. But if we've been smart scheduling for the routine things, it's a lot easier to accommodate those emergencies. So if you've racked and stacked them at 9 o'clock, 9:20, 9:40, 10 o'clock, 10:20, 10:40, and an emergency comes in the middle of all that, you're toast. You're in trouble. You're going to have upset clients, upset dogs. You're going to be rushed. Your staff will be upset because they have too much to do. If you've spread out those appointments, you can easily accommodate those emergencies as they come in the door. And interestingly, we have a problem in veterinary medicine with anxiety in staff and people being unhappy and leaving their careers after just only a couple of years because of the burnout and everything. When you create these calm environments and schedule appropriately and manage your own time, you love going to work every day and getting back to doing what you love to do. So emergencies are emergencies. We see them when we need to, but we try to schedule the routine things and spread them out.
Okay, great. The next question is, do cats have similar color preferences to dogs?
Sorry, do they have similar? I didn't hear that.
Similar color preferences?
Color preferences, like blues and grays? Yeah, I don't know for sure. We think probably they do. There's some suggestion that whites are a problem because it said that there's some things that are added to white cloth or white material that can fluoresce in a pet's eyes, both dogs and cats, and be visually jarring to them. And so where we can, I think it's probably wise to try and stay away from the whites. I'm not sure just how well documented that is, but there's talk about it, and I think it's important to keep in the back of our minds. The blues and the grays, the greens, we know that they're good for dogs. I don't know of any studies specifically done in cats, but there's no reason to believe that it would be any different.
All right. The next question is, do you sterilize after numbing the area on an animal?
So to the same extent that you would for the procedure. So if you're taking a blood sample, right now, if you're not doing it sort of in a fear-free way, sort of let's call it the traditional way, you put a drop of alcohol. Actually, you probably put a whole squish of the bottle of alcohol on the pet's leg. And that actually probably doesn't sterilize the skin anyways, but I think that's what whoever asked the question is getting at. You would still use alcohol on top of your numbing. And so you would put your topical numbing agent, whatever you use, you'd wait the appropriate time, and then you would put your alcohol on top of that. And I just want to remind you, the vein is only about 3 millimeters wide, and the needle is only a fraction of a millimeter. You only need a drop of alcohol. You don't need a whole squish of the bottle. You're only looking to hit that one little surface area if you're going to use it at all. So I think that's what they're getting at with that question. So yes, we will still use alcohol for blood collections.
Oh, and she actually followed up and she said that she meant for IVCs, not blood draws.
Yeah, so for intravenous catheters, for sure. Yeah, we'll triple prep them. We will we'll shave the area for our intravenous catheters. We'll numb the area with the prilocaine, lidocaine, amla cream, and then we will, after that's soaked in and the skin is numb, we'll triple prep and go ahead and put our IV catheter in for sure.
All right, awesome. The next question is, does topical lidocaine work if the skin isn't shaved?
I love that. So some hot debate, and there are some people who absolutely insist that you have to shave the area and put your cream on and then put an occlusive layer on top of that, and they will swear up and down that you have to do it. I'm going to argue that in my experience, you probably don't have to do it because, and I'll show some videos again at the conferences that are coming up, the difference between having it on and not having it on, having the topical anesthetic and not having the topical anesthetic. And you can see a difference without shaving and without putting an occlusive layer on top of it. That said, does shaving and putting an occlusive layer, does it have some added benefit and make the topical anesthetic even more potent? Maybe it does. Maybe it's true. But I do know for sure that you get some benefit from anecdotally, from experience. My techs swear up and down that when you use the Emla cream or you use that the lidocaine spray, even though you don't shave and don't put an occlusive layer on, those pets have a much better experience and are much more cooperative for their blood draws and IV catheters and cystocentesis. And I'll be showing videos that show that.
Great. The next question is, are there any interactions with blood tests when using topical lidocaine?
I'm not sure. I'm not aware of any. I can't imagine why there would be. I would look at it as putting a dab of alcohol on the skin. Does that lyse the red blood cells? I would think not. That having been said, speak to your local clinical pathologists and ask them. We have not seen any difference whatsoever, and we have done it for thousands and thousands of pets, and we get blood results back and urine results back completely consistent with what we'd expect. So I really seriously doubt that it has any effect on the results. I will tell you though that not using it probably has an effect on the results, because if you don't use a topical and those pets are struggling every time you put that needle in, then they retract their leg and their heart rate goes up and their blood pressure goes up and their catecholamines and cortisols are released, and that's when you get those stress leucons, the high white cells and the high neutrophils because of anxiety and stress. That's when the blood sugar goes up and you start wondering, is that cat diabetic or is he just stressed? And you start, the spleen on those large dogs contract and you get the much higher hematocrit. And, because those blood is now in the peripheral circulation, all those red cells are in the peripheral circulation, and you're thinking, is he dehydrated, or does he have polycythemia, or does spleen just contract from anxiety and stress? So I think you're more likely to see that from not using a topical anesthetic than you would any change from using one. So I just seriously doubt that there's any change.
Okay, great. The next question is, can trazodone be used every day for dogs who are afraid of things at their home?
Yes, it can be. The doses are generally a little bit lower, and it's used a little differently. So So you might use, and speak to your behaviorist that you work with in the in your region, but a lot of people use that around 1 or 2, maybe up to 4 or 5 mg per kg, and they'll use it sometimes twice a day. And in that case, when you're using it at sort of the lower end of the dose, what you're doing is so trazodone is a serotonin antagonist, and it's also a reuptake inhibitor. So you're playing more on the reuptake inhibitor part of that when you use it long term, in that the serotonin comes across the presynaptic membrane, floats through the synapse, and goes to the postsynaptic membrane where it hits the receptors and has its effect. And then it comes back across the synapse and gets recycled. But if you don't take it back up, then it gets to hang around in the synapse longer and will find its way back to the receptors faster. And that's when you use it long term for its behavioral effects. That's how it works. And it does take a longer period to see that benefit. When we're using it for an office call and we're just giving a dose 2 hours before, we're giving it at a little bit of a higher dose, and we're relying more on the immediate effects on the 5-HT2A. There are like 50 different, if not more, serotonin receptors. We're just hitting on that one big one that dampens excitation, and that's its antagonist effects. So yes, you can use it long term at a lower dose, and check your pharma books. They're all there, but just know that it takes a little bit longer to work for what you're looking for, and it's working by different mechanism of action.
All right, and the final question is, how long do the Torb combos work in dogs and cats?
Well, that's a good question. It depends how you're using it and what dose you're using it, and how anxious the pet is coming in when you start it. So, if it's just like any other drug, if it's an old frail cat and you're giving it a high dose of butorphanol, and you're mixing it with something else, presumably there's some synergistic effect, it's going to have a much longer duration of effect. If you're using it on a young cat at a low dose and you haven't given a pre-visit pharmaceutical, then it's going to have a much shorter effect and maybe an insufficient effect. So I think you have to look at it all in totality. I will tell you, and it's a good point, because I find that a lot of the cats that we send home, and they come in with gabapentin before their appointments. So we talked about a third, maybe a little bit more, that come in with about 100 milligrams of gabapentin. Those cats are usually in great shape. Some of them do need added sedation on top of that. And if I give butorphanol on top of that, I can always add more to it if I need to, because if I give the Torb, ACE, and ketamine mix that I showed you as one of my favorite injections, those cats are out for a real long time. And so I think you have to look at the pharma of all of this, and how stressed is that pet? What other concurrent conditions does it have? What pre-visit pharmaceuticals or pre-meds have you given it? That's all going to influence that. The combination that I cited there, they're out for about 20 minutes, if that helps. It's great way to get an x-ray, great way to check inside a fractious cat's mouth, great way to check their ears, great way to get a blood sample and a quick cysto and get some vaccines in there while the cat's not even moving or aware. And then they can go home about 20 minutes, half hour later, they're waking up.
All right, that's awesome. Thank you so much, Dr. Bloom. Thank you, Elanco, for sponsoring us today. And thank you, everyone, for joining the webinar today. You'll be able to find this recorded webinar on fearfreepets.com within the next week or two. Thanks again, and have a great day.